healthcare professionals, nurses working for the NHS in England. We are not medical doctors. We're here to raise awareness of all non-communicable diseases. Example of them is diabetes, hypertension, the cancers, and all other health issues that we know are affecting our people. We are not here to prescribe. We are not here to diagnose. We're just here to tell people about some diseases so that when we tell them about the signs and symptoms, they'll be able to watch out for these signs and symptoms and go to their medical doctors or their healthcare providers. The videos we play are taken from YouTube, where everybody goes to look for information. They are not ours. So with this, I just want people to know that all we're doing here is raising awareness of these diseases, because not all of our people can go on YouTube and access the information. Thank you very much for watching us, and please continue to watch us, because you will learn how to take care of yourself, because health is wealth. Good evening, una good evening, family them. We hope say una don't come back today for joining we the health show. We hope say una they survive this coronavirus. We hope say things they go well for una and una family. The year and I don't go wrong so. Now June we don't reach so. Anybody will not plan himself up to this term, I they beg you for let you plan what you want for do. If you want for married now, do you have for try marriage? If you want for divorce now, do them again this time. Whether you hear don't answer. So you get 6 months for me you live with what you do. Because any decision where you do at this time of the year, you get 6 months for me you able for, by your bioram and really think of what you want for do. So today we don't come back for talk about prostate cancer. When are the cancer where we know they talk about so all the time? Because nothing where something for hide. Just like other cancer the way they serve the hide. Something we not they hide, but really the prostate cancer and cancer where people are not they talk about. One, we man and they get them, they're not they even acknowledge say they get them just because they feel say they're a man, they're macho, they're not for sure that weakness, and I make it they kill people then. So before I go further, today I talk again now so with Miss Bintu, where instead now a nurse in England, they introduce himself again.
That's a short introduction, Salome.
Well, I they always talk every day, say, this big mamina nursing, but if you want for talk that day, every day I go talk about things. Say now everybody don't know. Say yourself now baby woman and nursing, you don't be what manager, you they had anemia, you they had renal areas them. So I think say, they talk all the time, but if you want for make they talk always, what's the problem, baby? I go talk her. So tell the family I'll do, and you can still introduce yourself. Not a problem.
Well, good evening, me viewers, family and viewers. When I welcome this evening, me na Bintu, the Calm Nadi show with for can present with Salome for can raise some health issues, them awareness about health, about different types of health conditions. Them. So today we dey talk about prostate cancer. We they talk about prostate cancer, we they can talk about for raise awareness about the prostate, because people in the prostate cancer, they don't know what's in the prostate cancer, who say they, what they do. So today we they can talk about the male reproductive system, where now the prostate cancer, now there you go find the prostate. So the prostate is a very small, tiny organ where they between the bladder and the penis. The two we call you man. Now they find this small organ where they call prostate. That prostate it get a very important role for playing. But as the show go on, we go continue to explain and go into details. Waiting at the function of the prostate, waiting go happen if the prostate not they go well, if the problem happen with the prostate, waiting go happen. So we go talk about that day, and the main focus today now for raise more awareness about prostate cancer, especially for we country SALONE, because prostate cancer is on the rise globally, and especially for SALONE, prostate cancer is on the rise, and we now get the services them where we need for little we able for detect early, for little we go treat people with cancer, and people they know they come forward, and people they know they express say then get this problem, because the condition with the prostate now a very embarrassing conditions them where you they face where you get prostate. One, they able to get erection as a man. That's where make you man. When you get sex or sexual intercourse, they able to get erection. So that is now one embarrassing thing for man them. Then the other two where the prostate they do where you get problem with the prostate, they become so enlarged that you're not able for your bladder, they become so weak. They begin to dribble, they piss fast, and it's embarrassing as a man. So today we can talk about prostate cancer and educate we man them and look at the one day where they at risk, the signs and symptoms, and we talk about how we own country SALONE, the current situation at SALONE right now in terms of prostate cancer is on the rise. Until last week, just recently, His Excellency Madabio don't approve a $19.8 million funding for build a state-of-the-art cancer unit in SALONE. What does that mean? It want for build a cancer unit in SALONE so that people are not go other countries like Ghana for treatment for cancer. So that we say we'll get with your cancer unit, we'll go with specialty doctors them, because at the moment I understand now only 2 doctors them we get in a SALONE where only know about prostate cancer, one of the master sabi people there for manage cancer problem, and we not get nurses them where they help them doctor there, so we know much about cancer, we'll go able for educate to people there, educate women them for about this condition. So I go pass on back to Salome. As the show go on, we go talk a little bit more about prostate cancer.
Thank you, Nasbintu. Thank you. Today we are on the health show with me when I present Salome Heights. We don't come back today for talk about the prostate cancer. Prostate cancer, as in column. No name, not the way we go break down for column. This na cancer we will not talk about at all. And this na cancer when a man the number they affect. Man the number. Because everywhere you talk about breast cancer, you get man the way they get breast cancer because of some gene way faulty or something. But when we say prostate, woman not they get prostate cancer. Now man the number they get her. And waiting at this cancer what they talk. Before this show, we don't talk say cancer now where you cells them, they multiply. You're not able for control the body, not able for control how you cells and they multiply, because normally what they happen with the human being. As with the age, now so we cells and the age. So when you cells and the age, they're supposed for die and go, and then new one then come. But what they bring the cancer about? Now, where you young cells and they multiply no more, they go out of control. When I say uncontrollably, it increase, it multiply. Sign they for do, for men and go, then they die, then they bunch together, then form a tumor. Now the same thing they happen even with the prostate cancer. The cells and just they multiply, then they die, then just they multiply, then they die. Say they go on that side. And who say this prostate day? Now delicate side. Because who say it they now they the mechanism they work. Now they the magic they work. When in they fertilize this sperm, where they do mommy and daddy business, whether man they ready say at the can away begin for talk about 1, 2, 3, 4, 5. Now that time they it say it enjoy this mommy and daddy business. Now that side up and the body, now they work all they happen. Now in the protect the sperm. Now they make sure say the sperm good, wait them they reach way you see that 5 heaven. So, but this year so if we talk we refer to people in a SALONE, service not in a SALONE for them. Even in this country, service not there Like how service day for breast cancer, or like how service day for lung cancer, service not day for the prostate cancer. And it's very drastic in black man then. If you work in London, you dey go na them bus stop there, you dey see the flyer then they where they show all the black man there, where some na 40 years no more they old, some na 50. They not even give 60 years so for say, oh, this na old person. No. And even the test where they give that prostate antigen test where they do. Not so all man know but then they now make we raise awareness now na the UK for we people that where they listen to we, and again with the raise na SALONE, because me know I know boku big man there we don't die. Where you ask, they say that thing they been get, but the time when they get money, they fly, they can oversee for can do the operation, them don't pass. Because the symptoms there again, you know, they just come out so. Boku thing go happen so you go feel saying other thing. You know, they even attribute it, and because we man them, they know they go hospital, pass something, they knock them, no pass and see the malika self they can now for can't take the life now they hand. Now that's then they go hospital, because man feel say if you go hospital every time, now weakness in the show. Or if you go say, hey, me wife, now this they do me, the woman can say, but come on, in a poem, you know, it will be a pain, you know, it will do this. So take it say with the woman, and we can put them off again. But as a woman, if you see you and that man they do that mommy and daddy business, you see the way they come now, where they see the heaven in self, they can you see it, they twist in face, you see say they in pain. Ask her, say, what's it wrong? Pass if you not the woman way they do mommy and daddy business, they set you yayo. So you're not gonna see you man in face if he glad for you, where when they do this mommy and daddy business, or they feel pain. Oh. So now set you way they do mommy and daddy business, open you yako, and then you look the man in face. Then you see if they show like say they feel pain, then set you go ask and say, why you they feel this pain? What thing they happen? They go say, but why I want come and they feel pain? Then you go tell and say, when this thing has so begin, then he go tell you. You go tell and say, okay, this not normal, because last year when they do see my man daddy business, you know they sour you face so. Now they observe say why they look yourself for me, you smile to me, say nah twist you face, let we go hospital. When I go hospital, if they catch am quick, it go able for save your life. If you left and say water don't pass flour, you're not able for patch down the pass the die cam. So when you they do that my man daddy business, you see say they begin for feel pain, you the man where you want come. Why say where you want come? When that spam they come on now, you don't know say you don't work like man. Whether pain they come to you, do you tell you with, or even go hospital, go tell you doctor say, pana so they happen to me, oh, and they do this thing, I don't play, where they get me reward now, and they get this pain. They also go tell you say now so. Now they say that they open cancer units. That if they do that antigen test, you can go there, you go do it if you're able for afford them. Because this one, not so like any kind of cancer, this is a cancer where they really above man there, and they quite say, black man go say, I get this cancer today. Sometimes 6 months down the line, if he reach self, he don't die. It's very drastic in black man then we wait people them. So if you're not black man, you got to take care of yourself. If you see say you the peace, you the feel am, no problem. You the peace, you the see say small blood inside the piece, not say this is just infection, go hospital. If you see say you the do my man daddy business where you the calm, it painful, go hospital. Because of the 3 classic signs and they were not supposed to happen to you as a man. If it happened to you, you know say this is a problem. And that side whether prostate they now who side the piece they pass. If it big, no problem. If you wet, when man small, you see them picking away then the piece and they tin up, so then send the piece. Even the man then so then they send piece. But when they reach now, whether side they don't be, whether they say it don't enlarge, you prostate don't enlarge, the piece, you know, they fire again, no, you know, they go again, no. Now, so no more they drop, like we pump the lock, the water they drop one. Now, so the piece go they drop, you know, they flag, you know, they even able for go inside the toilet. If you see that, then it happen to you, do ya not sit down. You prostate don't enlarge, you therefore do something about that. So we done there, I go left and small back. I don't talk about the way they where they piece you they feel am, where you they calm, where you don't do the mommy and daddy business, them don't get away for say, I don't work down now, they get me reward, where they ejaculate like where they call her, where you they calm, they hurt you, they always they feel say you want peace. It's like always you blood are full, you want peace, but where you go? The women they must say na tenny, out in my color. Where they drop one, you know, Sabi?
I'm not sabi.
Okay.
You don't seem me bad.
Okay, like when you something they drop no more, tenny. That's how then you know say problem done they do ya. You forgo to doctor, then you tell them say now this thing they happen to me, what thing I go do, how I go help myself. This also about you the man being macho or you be a weakling if you go hospital. This not something where you for do, you for no say something happen, now that me pipe. That pipe there. And Trade will be show a video where the man talk say where you they do mommy and daddy business always is very good. Because where you they do them, it's like you they clean the pipe. So they say man for ejaculate 21 times in a month. Will be play that video there. They say 21 times you the man, you for ejaculate. That means say that pipe there, you for cleaner. So do ya mama them help this man clean this pipe. May ejaculate 21 times in a month. If you want to make like ejaculate 30 times in a month, then every day one, say the month done. Be enough for help with brother, they let them clean the pipe. So with that, I want to not being to yourself pass some message for this prostate cancer. Thank you.
Well, I don't know, because we the blacks, them Africans, we they at risk of so many things. When it comes to diabetes, we they at risk. When it comes by hypertension, we they at risk. When it comes by vitamin D, we they at risk. When we come by COVID, we they at risk. When it comes by prostate cancer again, now we they at risk. We the black men them. One, they don't know why, but they link on to age. Because they say prostate is common in 90% of men as you they age, where as you 50, then they recommend say make you begin take check and go check yourself and screen yourself for prostate cancer. But for the black man, then they recommend even from the age of 40.
Yes.
Even from the age of 40. Why? Because they're not they wait for the age again where reach that 65 where plenty people then they begin develop that prostate cancer. Like waiting SALONE don't say now the cells they will become abnormal, they cause tumor and then spread now the all parts of the body. So 3 conditions with the prostate. The prostate you get 2 major roles the way they do. Like waiting SALONE also say it help for make the sperm. So that it will nourish the sperm, it will protect the sperm. So when you the sperm as a man, the sperm now they go to the bladder. So now the prostate now they help for get that mechanism there. When you the sperm, it they go straight to side for going, not they bypass. Then when you the piss back, the prostate now they help the bladder. So let it not go to the other side. Let it not go side this sperm in sac there. So let the piece not go there. So they go direct. So now the prostate now they do that work there. So tell me, if the prostate not they work fine, and 3 conditions then they where they affect the prostate. 1, it can be infection, where it can start from as early as 30 years of age. They get infection of the prostate. 2, they get large prostate.
Mm-hmm.
The large prostate they can press on your bladder. When you don't begin see say you they grab fast na net for go piss. You want for piss, you not able piss. You they piss but quick. You they feel away the piss that the prostate where you don't enlarge. Now they can't sit down a bladder because the bladder now they all will piss them. And when the piss not they go according to it, they press on the bladder. Now it make people and they find difficulty and pain when they piss. And the major one, when you get to the worst, you get the prostate cancer. But all them tears so treatment day for them. So if you get the embarrassing condition they have. For example, you're not able to ejaculate, you dey feel pain, you're not able to get erection, you're not able for control your peace. Medicine and day. So don't feel embarrassed about it. Go to your doctor. Say na this how they feel. Talk about them. No shame.
No.
Because you go to suffer in silence. Not so you want get this problem.
Yes.
No say other people in back they go through the same problem. So with prostate cancer, when you get prostate cancer, not to say you just get and today it become worse. It take over long period of time for let it show say you get cancer. So when you get cancer, you can get cancer, it can be harmless, you can get it for so many years, you live normal life. You go about your business, you get treatment. The only thing about them when they check you and they make sure say you cancer, grow, develop. So the people that were there at risk, now we the black people then. The other one are age, the other one are family history. If you get family we don't suffer, we don't die of prostate cancer, we get prostate cancer, you there at risk.
Yeah.
They even say if you get a sister or mama, we get breast cancer, all form of cancer, you the man, you there at risk as well. So these are the things where they say lifestyle back itself now other risk factor. So all them here so don't make the black man there they at risk of this prostate cancer. So that make one for can talk to una today, me brothers them. Yeah, low una not feel embarrassed, low una not feel ashamed, low una talk to una partners them, low una talk to una woman them, low una talk to una girlfriend them, low una go to una doctor and talk about this. So that una go get help early. Because the problem now, waiting they happen at salon, people they know they talk, waiting they go on. People they know they talk about their symptoms, waiting and they see. By the time now then they go now to doctor, it don't late. That's when now the prostate don't pass mark, you know able to get treatment. That won't read it now because with prostate cancer in general, when you hear cancer, the first way they they can't die, and then they well again. But with prostate cancer, it's different. When they catch them early, then they able to give medicine for that. And I make you can find out say most people them, not for the cancer they kill them all. Now the wondering waiting there for can happen. Why don't get this sick?
Yes.
And majority they die with cancer than die from them. You understand? So people them they go they worry, say I don't get cancer, then go die with the cancer, than the cancer self-kill them. So now that they happen. So the earlier you get treatment, the earlier the better.
Thank you. Thank you, Nasbintu. Now we talk about even during this COVID. They say people are dying, black people are dying because of underlying problems. Now some of the underlying problems and this, because you get a condition where you don't know, say you get them. We get lots of people them, black people them, because statistics don't show say even at the US, now more of black people than they die from this COVID-19. And so it's the same in the UK where we are. Now lots of black people they die because now they get underlying problems where don't compromise their immune system, where make as the COVID comes so now them they fall victim of them. So now make we they say for SALONE where we they talk so the people that where they listen to it from SALONE, it's very difficult for me you go detect this thing you have to do like you PSA the antigen test for me they know say you get this cancer for me they able for help you. Because even at UK they don't talk and say the test is not widely open to everybody, like when you go say you they just go like when you reach certain age they go say go do your breast cancer screening, go do your breast screening for see if you get any abnormal cells, they go say go do this, they go do lots of tests, blood tests on you depending on your symptoms where they show. So even now after all this go past, because one day we go see this COVID as something will come and go. But when they talk about underlying problems, say that in they kill people then because they get underlying problem. No, not just talk about other physical health problems then. Let's think about all the non-communicable diseases. Let's think about the cancers. People that way they will get cancer, we undiagnosed, where they not go to doctor and tell them say now in you get. Because now we they say he undiagnosed because you not go to doctor and tell you say yes, now this time do you. So because of that, they now make with people then they die. Because of ignorance. The ignorance say you get this sick here. And what would they talk and so possibly the UK right now go say, hey, I don't 45 where this COVID done, I go to my GP lens and I go do this. But where we people in a salon, they not get that opportunity they, at all. They not get anything for do. So now would they just say to them the signs and symptoms because this particular cancer, if you catch person in a salon, the big man they always know say been get this cancer now yeah they come. Now England they can't do the operation because you not been go far, they're able for survive. You know, as I speak with you right now, I get somebody who very close to me will get this sick here so. But if they try, you know, that they treat her with all kind of medication, but not the right medication because it's not available in salon. So we people then they at the mercy of this sick here so within this salon. So we they raise awareness for this prostate cancer. If you na salon posse they watch we. Share the video, let people that are salon let them see. We they do this show at the UK, but majority of we aim now for the people that where they na the diaspora, especially sub-Saharan Africa and salon in particular, for let them learn about them disease where they went now, then they make with people then they fall ill and just die without we not know what's in the cause, and we not get the upper hand, we not get the opportunity. For let them know say that this do me. At least if possible, they let them know say that this thing kill me. Let not just go lead on a net, it grab, it don't die. We'll say na witch, we'll say na juju, we'll say na witch gun they don't fire with. Because we not they do post-mortem again. So how you go know waiting do you posting? So today we talk about the cancer of the prostate. When I dey involve with people them, and it very drastic in black man them. Now make if you're not black man, you even then at this side of the world, go do your test. With people that where they salon, like I say, then they are the mercy of boku sick where they catch them. Some people that they don't live with diabetes for 10 months, 1 year. And type 2 diabetes, you go live with her for 10 years before you know say you get them. Sometimes the day when you go into the diabetes coma, now that day you they die, now that day you people that they know say you will get this sick. Hypertension now na salon is so high. So all them sick then if you get an underlying problem for this COVID. So they pray. Let this COVID not go salon in a big way. And I make they appeal to people that for me they able for follow instructions, wash your hand. If they use public transport, you get mask user. And I'm so glad that lots of the videos where they see from salon people that wear their mask, then they do their social distancing. Let we not forget what the Ebola virus disease do with we people there. Let we learn for take care of ourselves. Just the hand washing will save your life. And social distance. Not joking about they go up and down like fly. Go where you know say it's necessary for go outside you they go. So with prostate cancer, if you get an underlying problem, you got to watch out for the signs and symptoms. For that you able for take care of yourself. If you didn't here, that's why you did America, you did England, you did Australia, you did China, any side you did. If you did watch me, now for me you go do your test. I don't know if we get for welcome the people that we don't join we know say people that they don't join me on Facebook, on YouTube. So if we don't no comments not there now, may we just welcome them and tell them thank you for always when they come. Oh, who is that? Saidu Soiree. Thank you very much, sister, for this wonderful information. Yeah, thank you too, Saidu. As a man, please take care of yourself. If you live in the diaspora, go and do your PSA test so that you know if you have this disease. Like when I've been to be said just now, if you na family person, your parents and they are alive, you go for watch waiting you daddy they go through. If your daddy don't die, most of who daddy that will not able for know waiting kill them, will not know waiting. But if you're a man and your papa don't die, maybe at an early age, you get for know waiting be happen to them for let you take care of yourself. Just like with the woman that we can talk say, if your mama die, they say na in Bobby, but na which gonna be fire and na in Bobby do ya when they reach of age, go do you breast test or you screening for me, you know, if na breast cancer you get. Because anything where you pass before quick, it will help you. Not let's see, don't say sick, more now you will you not get nothing for do again before you take action. So I don't know if you want to talk about some of the early signs them, because I don't talk about where you they urinate or where you go piss, you they feel up. We don't talk about blood in the urine. We don't talk about where you they ejaculate, you they feel up, you they feel pain. I don't know if any other thing the way you want add and then symptoms and the way you get for lookouts for and this cancer.
Even way they spam self, they see blood now they spam. So down the back now, other sign back from show say you get this prostate cancer. So most of the signs and symptoms them where you don't mention SALONE, where they get this burning sensation, they get pain, where they piss, where they make love, they get this where you want for ejaculate, they get this pain. So these are all the signs and symptoms where they get. And the other thing again where the prostate they do is where you get a large prostate, they really block the tube there where they come towards the bladder. When they get a backflow na the tube where they go back not to the kidney. So if you get a large prostate, it cause kidney failure as well. So they cause because they get the backflow, they go back na the kidney because the kidney now they help for make the urine the piss so they make.
Yeah.
So when you get a large prostate, it don't put so much pressure on the bladder, they get this backflow and they go back to the kidney, it cause obstruction.
Yes.
And then it can lead to kidney failure. So now some of the things that no one in there where with the prostate, you can get to prostate cancer where the cancer go just then at the prostate, but then it can spread. When it gets worse, it can spread, it go to other parts of the body.
Thank you, Thomas. Thank you for joining. My number one fan. Take care of the prostate. After COVID, I want you to go and do your test, okay? Thank you. Well done, viewers, for such educative program with this. People can be aware of the positive implication. That's true, Ibrahim Sise. Thank you very much. Share the video, share the message with all our people, because you men, you're very, very stubborn. You don't want to go to hospital. Go to hospital and do your test, please. If you live in the diaspora, because the test is there. It's just for you to ask. Yes, sorry, you can continue.
Yeah, so until so the cancer it go spread, it not go just dead at the prostate, it can go na the other parts of the body, when at the bone, when at the liver, it can even go to the spine. And when you go to the spinal cord, then it can make more, you lose control, like you're not able, you get this incontinence where you're not able to control the piece just to come up at you. You not get control for yourself again. Like we say, you're not able to function as a man. Now I make most times where we don't hear that talk the way you can say they go buy ball for them picking. Then them pardon and they talk. You go buy ball for them picking because you demand when you don't carry age, you're not able to do anything and then they try for say you're not able to function. So he left the woman, so that young boy there.
Yes.
Way more active than you. So they are
It's not funny, It's not funny. If you're not old pa, the thing not begin die. Then you go marry the young pikin. Now we can say you go buy ball for them, but for play for you. Now that talk the thing straight. How you they bend the talk? Now that's what they talk.
Yeah. So now that so no feel embarrassed about this condition. It very, very common. It common na them party where we then get everything.
Yes.
It come on here. Then I say SALONE, we not get anything until we get a diagnostic center, until we get the specialists. Because when you get cancer, you need a multidisciplinary approach. You need the specialist doctors them. You need the specialist nurses them. You need other members of the team who are able for direct this patient wey don diagnose to the right services dem. So you need a lot of people dem. So until we get a diagnostic center or the state of the art where the government dey propose, so the rise for prostate cancer, it will continue for rise na SALONE, because the education not there, we not get the specialist nurses them, the nurses that we then get at the moment are just general nurses, we not get any special, because for let you be a cancer specialist nurses, I'm sure I have some cancer specialist nurses watching us, so please, we need your contribution to help us with this topic. We are not cancer nurses, but we will doing our best here, we will do our best. And also, una the patients that, una the people that way they view we. If una don't get any experience, una share with we. If una don't get the all clear. Like we go say, I be get cancer, but it don't clear. Waiting a story, share a story with we.
Yes.
Now we learn from each other.
Yes.
You know, then they go help motivate other people, and then they go help inspire the other man then. Let them know say somebody we don't get this sicker, or they've go through this condition, it don't feel better, it don't feel well, or now this they manage. Now so it manage your own condition. So that other man them go grab and go do this test when the time reach.
Okay. Thank you very much, Bintu. And one thing I want for make una know, when you get this prostate cancer, for me, you begin getting signs and symptoms the way I named to you. Where you do my man daddy business, when you want to reach that enjoyment side now, you begin feel pain. You face a sour, you go nearly they cry because it's painful. When you begin get that, they know say already that you prostate gland, it don't already big, it don't enlarge. For letting symptoms that they show, that because you don't already get the sick. Because it not go show until the gland don't big. So you get for do that. And when we talk about erectile dysfunction, when I can always talk about diabetes, I can talk about for Lemanton Okobo, where the parents themselves they die, it starts with that erectile dysfunction. Because you go down play with mama, like when they say foreplay, you don't do all kinds of way, all the magical you think are able for do, you don't do all that day. Then tell Rich like you want the pastor say go now, go meet the mommy and do the work. The pastor say no, I'm not ready. It happen one time, too many. Not say, oh, I'm tired, but hey, now the stress, now my mind. Go ask for help. Because either you don't get diabetes, we not control, make the teen they die now. Because wait, you not go wake them up. Oh, this is one time I will die, not a week. So you therefore be careful. So the cycle you prostate gland when in the sperm they make. Now the nerves and the back where they make you, they get this tinap triangle one. True. If you see that tinap triangle one don't begin left body, you know the tinap triangle again, no say again, that side they then nerves and the back, they don't start for destroy themselves. Because if they don't begin destroy or a tumor don't they present, then you know say you not get chance. So if one time too many, this fire they tell you say I'm not ready, oh, you go do all kinds of way you want for do the thing, you say I'm not ready, oh, and you not get diabetes, so you not get no injury, you go make this fire not grab. If you see the fire not able for grab, you can do Now for me, you go seek advice. Not to tiredness, not to stress, not to aim. But you don't say I don't do this in I aim you so now I made the things I'm not the work. No, not to aim. Go seek help. Go seek help, because this one, like I say, that part, if he die, you may wake again. You go do Viagra, you go do all kinds of things. Even people that they not doing medicine where they get that sexual dysfunction, but not so like SALONE. So then get boku thing that they even get one pump. When they put up at the part and pump, it draw the blood cut inside the part, then the part head go grab small. But how long you go dey panande? So before you reach all that pump, they not easy. Forget the Viagra back when they take them for let you treat this sexual dysfunction. It's not easy forget. Again, you don't know how you had day. They say cow old tay, but liba not old. No, motama liba go olo because you're not to cow, you're not to ox. So if you don't begin get same problem, then they not just go take Viagra. We say when they not the diaspora where they go, the party don't say boy this thing I don't begin above me, you know they work better now. You know, then to see then they can one knock them, but another will knock them better, sell the thing they above me. You just buy boku Viagra because now then they sell her over the counter now. You buy, you can't go for. You don't know how in heart in stage day. You don't know if you get heart problem. You don't know anything about your physical health. You go get Viagra. Where you go die. You not go say, I've been getting Viagra when I look back at the Viagra killer. You not go talk that day, but you go just say now you hate it the past. We have the doctor in Sierra Leone right now trying to reach you via WhatsApp, but having a problem to connect. Oh, Bobson, I don't know what to do. Let him keep trying, please. Thank you. Or he can pass the message to you if he can't get up to us. Please, thank you, Bobson Kabia, and welcome to the Voice of SALONE Network. Thank you, ladies, for the awareness. Caller as many men are not aware of this. Yes, that's why we're raising this awareness. Because when things happen to men, they think they are so macho, they can't go to hospital. No, whatever thing happens to you once, twice, 3 times, too many times, you need to go seek medical help. Not to witch-o, not to anything. Well done, viewers. Keep on the good work. God bless you all. Thank you very much, Zainab Koroma. Welcome to the show and thanks for your contribution. We love you all. Keep on watching us and please share the video so that everybody will learn from what we are teaching. Thank you. Yeah, so we talk about sexual dysfunction where we say the thing not go work, and then we're being to mention about incontinence. What do we mean by incontinence is where the piece go they come out so no more now, where you not get control over them. Because normally, if a woman can be incontinent, they're not able to do the pelvic floor massage and hold the piece. Then they make you become incontinent. But for the man, they say just now, the piece. When you can up now, you fire the piece, they go like 2-3 meters. That's how the power, it gain power. Then tell each now, the piece they drop 1, 1, 1. If you begin to do that, they no say you don't get problem. Then be to mention the incontinent, where the piece now you're not able to forget control over them. It just a come on out. It just a come on out. How embarrassing that they be. For we people that are salon. We're not getting no help for this. How embarrassing than they did. Anytime you pass a motor man, big person piece they smell. So how embarrassing than they be. So do ya when we take care of ourselves. So on that note, I go on for make we just take a little break for make the we listen to we sponsors them. We can watch with videos and when we sponsors them. And then we can continue back. But meanwhile, we want for welcome people that we don't come. Wanna share the video, wanna share on a salon. The one that they try for call, do ya wanna not relent, wanna keep on dialing. God go make wanna go able forget we because we want you wait till una send the give.
Oh, that's a call.
Good evening, caller. Who said they call from and waiting at your name?
Good evening, Dr. Kapua on the line.
Dr. Kabo, how are you?
Kapua.
Kapua,
Okay,
oh, hello.
Kapua, yes.
Yes, Dr. Kapua, welcome to the show. Welcome to VOS.
Thank you for having me.
Yes. So how can we help you?
Oh, well. Hello?
Hello, we're hearing you loud and clear.
Okay. But it's just on the prostate cancer as I don't start the program.
Yes.
Yeah, so we need to talk on the incidences, the case fatality, and all the other issues that we will get for now within a salon.
Thank you very much. So welcome to share this with us. We appreciate you so much. So let's have that. Your contribution is really valued, and we're really happy for have you here. Anytime we do any other thing you want for join, we please do.
Yes.
So we wait for that statistics so they can share with me. Thank you so much.
Yeah, you're welcome. So generally, of course, we also, I don't know, are we to do it in English or Creole? Maybe for people, I don't know what's the
Yeah, so we
advice.
can go yeah.
Okay, okay.
And also
Prostate cancer.
yeah,
We all,
if you
as we do,
come
because
back,
they follow the program on Facebook on our
okay,
program. It's very
okay.
nice, and so the statistics not too good, especially for salon. Why they say so? Because like for now, Naina the second highest cancer in general. That is after breast cancer, the next highest rate of cancer we they see now we clinical practice na prostate cancer.
Oh,
Yeah, and in males, that was just general. In males now, and we demand them actually the prostate cancer. The statistics they change. In 2018, for example, prostate cancer be the number 2. That means be the second after liver cancer.
wow.
But in 2019, we see say prostate cancer can beat liver cancer in time. So now the highest cancer we'll get in males in man them na prostate cancer.
Wow.
Yeah, and the figures like for 2018 will be get according to the World Cancer Observatory way now they will send the data they will they get we get 9.5% of cancer in general. That prostate cancer be account for 9.10%, 5%,
Oh,
sorry.
that's
But
a
as I
big
say, the jump in 2019 from 9.5% we get 24% prostate cancer in the country. So we see
yeah.
that huge jump. But then they go report, then they go mean so many things. Number one, now because we don't they try now for GIMO reporting because before the rate of reporting was very very low and the WHO and the World Cancer Observatory not be they get then data then they. So
Yeah.
most probably one of the reasons we make prostate cancer jump to 24%. That is the running cause in 2019. So from 9.5 in 2018 to 24% in 2019.
So there's a
Yeah.
surveillance
So
system now.
yeah. So the surveillance don't they increase because we don't get a cancer clinic now, Connaught Hospital, we they cater for that now. So I feel say that they don't help in that. Yeah, and that be account generally for now in the world where then of course studies, different studies who don't do, we get about 185 countries. Salone, according to the number of prostate cancers, we did 43. So you see, this they show say we get quite a high number of prostate cancer.
Yeah.
The signs and symptoms, of course, we don't abdor anyway when they talk most of them when and most of all the when they talk now too. We
Yeah.
get for no say the prostate, I feel say all man they know it's not. Now man they no more get and to start to man not get prostate. So now we
Mm-hmm.
demand them more they suffer. Now we they suffer from them. It is
Yeah.
below by the penis, inside by the base of the penis. It is inside at the outlet of the bladder. Then now the bladder and outside the urine, the piece they store or they urinate. And then
Yes.
the prostate there. So
Mm-hmm.
they connect with the urethra, that the pipe where they pass the urine or the wet out. That is the urethra. So now the prostate there. So in the take part both in as we talk, for example, when what we call semen, like when man they ejaculate after you don't get sexual intercourse. The
Yes.
prostate, that white they see, that milky something they see, now in the prostate, now they produce that fluid there.
Mm-hmm.
So basically, in your work now for lubricate the sperm cells. So the sperm
Yes.
cells they will get food, they will get water, so outside the day.
For
So that
swim
white
inside.
water they see by milk or whatever as you could call it, and the
Yes.
prostate now they produce that. So generally, we they get any disease, as in this case now, when a cancer. But most of the signs and symptoms of prostate cancer also therefore no say is similar to what they call BPH, when a benign prostate hyperplasia. So it's when the
Mm-hmm.
prostate they enlarge. So the prostate they enlarge in this case, it is different from cancer. You know, mean say when you get BPH, you don't get cancer. Yeah, but the most of the signs and symptoms, like for example, wait till they get frequency. Frequency, that means say the man they wet fast.
Mm-hmm.
They wet fast as compared to how they wet. We also call nocturia. Nocturia, that means say they grab past street and foot and a net for go wet.
Yes.
You get forget that nocturia there. Then of course where the disease on the advance, at that time now they get hematuria, where they wet with blood or where they ejaculate with blood. So
Okay.
that level there now we can get that. The prostate, we can get what we call localized prostate cancer. That means say the cancer just there within the prostate cell first. And we can get what we call metastatic. That means say it don't spread.
Yeah.
They inside the prostate cell, it don't they take care of them. We grab na net boku for go where to know they take no attention about how not they go to hospital. So when the cancer they metastasize, they go the first side where they go to the bones there. Then they go into the lymph nodes. Then later it will go into the liver. It will go to so many other organs. But the bones, the first bone where they affect now this, like how they call it, this we waist bone. We carry some man there above the 50s, 60s. Say this me waist bone, yeah, they had unable waka, unable this. That of course, if that prostate they don't the thing don't spread, definitely what's in the happen from the vertebra down at the waist bone. From the vertebra now, they go because the waist bone, that vertebra then are through the spinal cord pass. It can go by the spinal cord now. If you go by the spinal cord, of course, now in the cause waiting, the man is not able. They're not able to get erection again. The penis not go snap where one get sexual intercourse. You're not able to control in wet.
Yeah.
They even be to a sensor. You're not able to control where one go toilet. So you get them and then what's happen? You go paralyzed if you don't get to the end. Then so now very serious issues where we try to treat patient and now they don't get a treatment center cancer clinic as na cannot middle in the province is actually at the Kenima. Myself they own a cancer clinic because me not a surgeon specialist but I do a certificate course in urology. So I take care of most of them patients there with BPH, with prostate cancer and prostatitis and all that, and then we do the surgeries and back. But we would encourage for let man know we say reach that ending now as they say where the cancer don't spread. But we get for encourage the people that they come now hospital, especially Monday. We know generally say Monday they're not like for go to hospital or pass it in the worst for them. So we get for the encourage them for come. Education is another thing. Now they do some sensitization on the media, radio, TV. Now we get social media. Officer and themselves will help. So we get for no say way that they don't happen. Of course, nothing step the kidneys back. If no say the kidneys are two very important organs their way, then they don't now by way back then they also connect. Now they make the urine. Now they take the urine after they don't take her from the blood, the excess, now they form urine where they can store in the bladder. So when the prostate don't enlarge, as I said that BPH in another instance, where it don't enlarge, due to that happen, the bladder capacity, the normal capacity is small. Because the normal capacity of a bladder usually they're about 400 to 600 milliliter. That is a normal adult bladder. That kind of capacity there we get. But then if you don't get a prostate, you don't enlarge inside it. So instead they take space. So in that sense now, you have that 600 mils of urine for don't store inside the bladder. You're not able to store until 200 mils go store. So now that make if then they one kind of the final say the man they feel for wet fast. So when that they happen, we get two types of symptoms then at the bladder where they happen. Number one, we get what you call the storage symptoms. Then number two, we get what you call the voiding symptoms. Storage symptoms are simply mean say, let me say now, because if they take 600, for example, now you don't they take 200. So if then they can over now, they even take, before you sit down 2 minutes, you don't begin go. So everything they happen, as you don't they get that frequency now, they get what you call urgency. Urgency simply means say now, where you don't sit down now, for example, you sit down a meeting or you sit down to talk to people, you don't feel for wait that minute. If you don't go wait, they come up by you. So now that. These
Okay.
other
Thank
storage
you.
symptoms where they happen, we're going to call incomplete emptying. Incomplete emptying it simply means say where you go wet. Usually where you don't feel for wet, you go wet, you don't you feel fine, you feel say you don't done. But in this case now where you go wet, you feel say so urine still left inside. So now all they will serve them the way they call. The treatment for now, we not they do radiotherapy in a salon. We don't hear say the government they come up in a cancer treatment center where and diagnostic now say they wait for it will be very fine. So the two main treatments we get in a salon right now. Now the chemotherapy when the tablet or the injection medicine they give or they do the surgery. The chemotherapy, we get a whole lot of other medicines so they use, but the main one is they call Zoladex or Goserelin, but then they very expensive. Most of the people they're not able to afford them because only one, if they're in two types, either you take one injection every month or you take one injection after every 3 months. The one injection where they take every month now $1,700,000.
Wow.
And the one injection where they take once in every 3 months about $4,500,000. So just one injection. So you go imagine with two people they go say, hey, doctor, for give me one injection, no more, I ain't cost that money. But I did not so the medicine cost way then they buy. Oh, most patients, of course, that is if the cancer not spread it, if not localized cancer. Most patients, if you know able afford the injection every month or once every 3 months, then we can do a surgery where they call orchidectomy. That means simply means a man they get what you call testis. That we both say simply in Creole or normal language. So first we remove then of course you know say surgery instead getting, but then they go help for prolong your life small for let you not go die that very moment there. Yeah, so basically I get a whole lot for talk, but if we're gonna get any questions, if the viewers or listeners again any questions, then they will ask and I go ready for answer them.
Okay, I get question where somebody asked. He said if you not get any percentage on, if you not get percentage of people that we don't call where the young cancer benign, or you get one that we get the metastatic cancer, if you not get any percentage with that. Now Judge Kamara where the US now they ask he said healthcare professional. If you not get any
well we get both cases. Of course, most men the way they come, as according to it, we don't see they get benign. Yeah, and they get the BPH because you know say some man and they don't let the loan on it. They don't waiting, but most of waiting they happen with the man them now way that they get with they call blockage. Now that they come in our hospital. That is so you know it be wet. You want wet, you know it be wet. What they call blockage. Now that blockage they count most of we man they're not know now they examine them now go no say oh well like prostate now you don't enlarge. I don't do so that they can be determined now. Of course we therefore do it to call digital rectal examination where they go use the doctor go use a finger for feel the prostate. They will do ultrasound where of course the ultrasound now go able to tell you if the prostate is benign or if it's malignant. Malignant means that name might be cancer.
Yes.
Yeah.
Oh, thank you very much. I hope, say, George, that answers your question. But the doctor, they online. If you get any other question for us, but these are the challenges where we people in our salon they face. Imagine they go for one injection, 4,500,000. So, what's in some of the people that when they come with that blockage, they actually able for help them? Are they able for do an operation for the way to make the at least you prolong their life a bit when they come with the blockage?
Yeah, definitely. The one that way they come with the blockage, we leave most of them. We go past catheter. We get Foley's catheter. We pass Foley's catheter in the able forward. Sometimes, unfortunately, the prostate can do so much enlarge that even the catheter not able pass. So they do a minor surgery for the at that moment. We call a suprapubic cystotomy. We can burst on top the belly area. We pass the catheter for let the urine pass. Then now on that instant, that time, then I will send you for go do different investigations there. We can the result then now we go say if na prostate because blockage not only the prostate because I'm back it be say get stricture where the urethra where the urine no able pass. So now only we count the prostate with the retention that the blockage will they help you first for the relieve you, because you know say when you don't the bladder don't flop, you don't come above you'll be like us, you enable. Definitely, you know, they feel fine. Some man they even die for that. So the first thing what they do now for relieve you, catheterize you. Normally if the thing pass, if you don't pass, we do it on top of your belly. Where I'm very minor surgery that they do in 5-10 minutes under local anesthesia, you know, they feel no nothing. Then you will send you for investigations now. You carry the result, then from there we start with management.
Yeah, I think I don't see them do that kind of thing there for somebody where na Connaught Hospital, na that ward. I think at the A&E, that's the way that they admit them, the way they come. I don't see them do that there on somebody. I mean, go find one me picking way being there in the diabetes coma. So
that's a life-saving maneuver for that moment.
Then now they say they go call one experience, so you can I say the man in bladder too full and you know they pass urine. That's saying now give me catheter pass it and through the penis. Now they hang the bag. Like from today we don't begin to be like they don't empty, you know. So when the catheter go inside the bladder, we begin come. I don't witness that in a Connaught Hospital. So now they do a very good job, Dr. Kapua. I understand say you know one of the doctors them way not too often a day na salon, you know the one person really blood when you come. I know say not so just about cancer, you go get vast idea of other things that we can talk about. We can talk about diabetes because I know you get people that way they carry it. They kick out in the diabetes coma now. They go come in, they don't get stroke from hypertension, or they don't get a diabetes stroke or in a diabetes coma. So you're welcome for 7 weeks because they're highly appreciated. And we really want more people that join, especially share the video so people that are salon go see what's in they go on. You know, we did talk this year, so now more for we people that are salon. You know, and I'm glad the way you someday get the benign one where the prostate go down enlarge, but it's still better. Judge say as a result, most of these men will stop drinking for fear of incontinence, leading to dehydration. When I don't come across that, because somebody they say now if I not drink, I not go piss for myself. So then they stop for drink, then they dehydrate. So now we don't come across them kind of case then they.
For drink, you mean? Sorry, I was a.
Then for drink water, he said, John they say as a result, some man can stop for drink water for men they not go piss for themselves. And if you stop for drink water because you don't incontinence of urine, it go lead to dehydration. Considering how salon warm so. They say, well, and this
definitely. In fact, most of the patients they can surprise because when they don't come, the first thing they encourage them and let them drink boku water. So they can say, doctor, why have to go drink boku water? Let this thing come for me back. But if they drink boku water because not only that, like just like I they talk, one for avoid dehydration. Number two, we want for always keep the kidneys active and working.
Yes.
Because if not of that, you know they taking enough fluid, definitely you get for damage you kidneys back. And in that case back, like where the blockage can happen for so many times, it don't become a chronic retention where they happen. Waiting they happen, they get a reflux. Reflux means that means say the urine way down there at the bladder instead of the common do through the urethra like the piece. If you're not able for water, just like how they say, water always needing road. If you're not getting road, it's a road for himself. So waiting they happen, the urine they go back up na the kidney.
Yes.
When you go na the kidney, now we call hydronephrosis because we don't go in the kidney, they make the kidney they enlarge. So then they have now other problem and they cause. So definitely we can get some of them patients that way they afraid say they're not for drink water again. But they tell us say once we don't relieve them of the retention, we don't pass catheter normally or we don't pass another up and belly as I say, they will advise the let them drink because then they also go avoid for foam particles in the bladder where later can lead to bladder stones and all that kind of thing. It can lead to infection. So the only way they take enough fluid and they help for clear the bladder.
Yes, and I judge yourself say to avoid urinary tract infections. You know, judge said they talk about and be to seven, the rub mouth panda reflux where the wet's not able for calm. It go back to the bladder full, it go back to the kidney, then the kidney now go get like it go get an infection, or if you continue so many times, you go even get a kidney disease or a kidney infection.
Yeah.
So people they actually plead now, say, do you maybe they come on the show all the time for let you say they tell we you expertise, because we not a medical doctors. If you watch me disclaimer, we just raise awareness of them disease here. So when we people then are salon for no, because even in the Bible it says ignorance will make my people perish or suffer. So
yeah, exactly.
For
so anytime we wanna get the health show, especially on any surgical, because me a surgeon specialist. So like when I go to get in diabetes, hypertension, I will take part of, I will like for like a physician specialist, like, but any surgical topic, I'll be very happy to be part of it, and I will give me your small knowledge and try for educate to people then.
All right, thank you very much. You go try get your number from Bobson, so maybe collectively we go bring up a topic where you say go be actively involved in, and we will benefit with people in a salon.
Okay.
Because we serve na healthcare professional and nurses, but with your expertise for backing up, people that will benefit more. So we really appreciate you. And if you get any questions, we will see direct them to you. Yeah, and then Bintu Sefwa give a word or two to you.
Okay.
Thank you very much, Dr. Kapua. We really appreciate you on the program this evening. We would like to see you more on this program.
Thank you. Yeah.
You don't just endorse waiting. We don't talk on the program when we start. You don't endorse everything what we talk about. So the know area from the experts.
Yes.
They know the master sabi person. Now they know area from so I believe say with this information, detailed information where you don't give with people, and so now something where now food for thought, where they go think about them, and then go take the appropriate actions where they need for take. So thank you very much for joining us on the program.
Welcome.
All right, thank you very much. We appreciate you, like I say, and our viewers, family, self, I know say they go appreciate you, because like what they say, we they do this every Saturday now. We they do Tuesdays, but now they do every Saturday. So as long as we will get your number from Dr. Kabia, himself can tune in, himself can tell in your own, it can make your own contributions, which is really valuable to we, you know, because we need the whole help on a salon in all day. Sometimes me they go salon at the 3 months, 4 months, 5 months, they go to different places. Dr. Dean in clinic, now one place that I can go raise diabetes awareness, I can go bring people. You know, so all these are for just help with people that way.
So as this maybe before I go, there's this other way because people maybe they ask, they say, well, doctor, what they cause is cancer.
Yes.
So we want people for no say, well, number one for cancer for now, cancer in general, not only prostate cancer. We still medicine still not actually know the right with self etiology. That means the reason why they cause them. But for prostate cancer, we don't say number one thing where that is the genetics. The heredity. If you first line family don't get like if you're a man, if your papa will get them, there's very high chances say you they get them. If you big brother they get them, there's very high chances say you they get them. So people therefore know that never they screen with self. Smoking is another thing we implicated in all types of cancer. So therefore, low down we smoke, we rate of smoking, or stop the smoking if possible.
Yes.
Cigarettes. That is very important. Then diet also don't prove it don't prove something, because there was a study where they say, for example, they take somebody from India, some people from India and some people from the West. Yes. And then find out say men in the West, then they get more prostate cancer than men in say India. And then we find the study find out say that because of the diet. Because in the India subcontinent we find out say people that they eat more vegetables, more fish, as opposed to now the West where people that they eat more processed meat. So processed meat also has been implicated in prostate cancer.
Yeah.
Without red meat, oh, they eat red meat.
And then ready-made foods as well. Just like what you tell people them for diabetes, where you they go eat buy loads of salt and sugar. Where you eat it just a spike you levels, you know. So it's very educative. I really appreciate
so
you.
we for encourage people to take more vegetables, more fruits.
Yes.
More fruits, lots of water. We're very good.
Yes.
And so more meat. The diet, you can shift your diet to more fish instead of more red meat.
No. Okay. It's true. So you don't really do well. We appreciate you. Thank you very much. And I know saying the viewers really will welcome you. Even the viewers will welcome you. Like I said, we go take you number from Dr. Kabia, where I know say no. Yeah, because I know say can't broadcast your number now, but we'll take your number from and then collectively we can agree on the topic. Where even because what we're doing here is mainly for our people in Sierra Leone. You know that means we even talk to curious and go understand. But even having said that, we can just encourage people that say, please share your videos, and if you have somebody that you can share it with, because I don't say they don't get that much, but they really just they stress on organic foods, which we have in Sierra Leone. We have loads of organic foods in Sierra Leone. We don't have like processed food. Sometimes we, the people from the diaspora, processed foods that they send, they care lunch or meals, they care ketchup, they care mayonnaise for them people that eat away. We sell stuff enough good for we because them processing they get so much fat content, they get so much salt and sugar content. All people that eat and they exercise, they just sit in one place, they get all the non-communicable disease here. So you know, so now that's what they really try for do educate with people them on any kind of thing. Yes, most of the food many get that carcinogens in our smoked foods. People then they eat like they smoke baking, that kind of thing, and they all that thing, and they in the long run when you sit down now, you know they do anything now that's it now they come back and haunts you. Because now waiting with they eat really most of the time waiting with they eat now they cause we forget lots of these non-communicable diseases, including the cancers. Because when you talk about smoking, somebody they smoke, it damage all the nerves, it go end up get lung cancer. But when you look at Sierra Leone, you see under that hot body, so you see people that they pump the cigarette like no man's business. Every day when you reduce one cigarette, it's good for you. You see people that would tell them say drink in moderation, take alcohol in moderation, but we cannot tell somebody to smoke in moderation. What we tell you is go for smoking cessations and stop smoking. Because smoking and they cause most of the cancers where we they get, most of them now from smoke. Your nerves they go damage, everything about you. You know, you go get the cancer where you not go just stop if not in your lungs, it go spread all sides. And look at medication for prostate cancer. You're talking about injections for a month, for a week. Without they able to afford that, you get to be very rich for me. You afford that. So we really appreciate you.
Yeah.
To say ask you a question, please.
Well, thank you so much for having me.
Yeah. I get a question.
So many other yes.
I get a question now from you for you from the viewers them. They say as the cost of managing prostate is expensive. How are you managing the increased cases right now? Because I know it is not easy with our people, right? And you as a health professional. There's how now they manage that right now because of the cost.
Well, just like how Abby say, if the prostate, if it confined only to the organ and not spread it, then the person will not able afford the injection, we can offer operation surgery. But again, you know, then they say can be a lot of things. You get to do a lot of psychological counseling, psychosocial, and that because how many man go once you don't know what they can't pull me test. Yeah, but the well, I'm not gonna say the good part, but the better part is that because most of the men the way they get actually studies don't show say now 60 and above years, so they don't pass 60 years. Yeah. So the only two who can encourage and now say, hey, pa, grandpa, you don't pass 60 years, what you get for do that? You know something like that. It's not funny, not easy, but most can afford, can agree say well when I do the surgery, when I remove the testicles and all that. Very few can afford the injection. Yeah. So we get a lot of challenges in that. And
I mean, just as I said, the balls are part of the package. So if that they don't come out, some man go feel like a lesser man, and all that day you will not get for that psychological truth, because he go say, wait till that.
Yeah. So recently now because of resources, but we don't get prosthesis.
Okay.
Like I go 2 years back. I go India. I buy some. I be the car with some prosthesis them. So we can actually do that surgery and put them prosthesis, so we get the similar feel and look of the testicle. We can also do that there.
You're not gonna knock. You're not gonna make sound.
No, they make sound. It's silicone-like, so they make sound.
Okay. Okay. Soft. Okay. So if the mommy they touch herself, you not gonna feel saying artificial or not so.
You not gonna feel saying artificial, yeah.
So that they're good. It's good for them.
Exactly.
That's normal because but we know saying we get for cancer that kind of thing because if we people that they afford the expensive medication, then you get the prosthetic like when you talk we not go too dear. I think so that they go work for them because it better let prolong life. So how about the resources?
Resources for
the resources for what? That's too short. Can you elaborate
like for the
somebody that says so about resources?
You mean from the patients or from the doctors? I not get the question.
No, somebody just put the question on. I don't know what he really mean. He says, so what about the resources?
Resources.
It mean like when I go India, when I bring the stuff, how they give the patient them? How they get the resources for do that? I don't understand. Bumsy, maybe you reframe the question.
Well, this have not understand, but waiting at the talk, we get we get pharmacies there where they sell the medications. So basically, we the doctors then just write the prescription and give the patient. After we don't counsel them, we don't tell them say this you need or this you need. So if the person want go for the chemotherapy, then we go write the prescription. Yeah, you go buy a come with the can administer because you get a special way for administer. Not so the normal injection or the normal shots. You get the special way. So definitely that's what we do. We give the prescription. You go buy the medication. You come, then we can administer it to you.
Okay. All right. Thank you very much. So at this point, we get a short video where somebody a doctor been doing an interview where he talk about the prostate cancer, where it talks say a man for ejaculate 21 times in a month, like clean the pipe out. So we watch that video day. After that, we continue the show because we don't really do well today. And thank you to Dr. Kapua. We appreciate you. So now
thank you to you all and welcome.
Okay, we will take your number and we'll go get it.
Okay.
So,
so I'll be glad for joining them back next time or anytime. I'll be there for a good time. Okay, so have a nice program ahead.
All right, thank you so much for your time. We appreciate you.
Welcome.
Okay.
Preventative practice for men for prostate cancer.
And what is that?
Sex.
There you go.
Best item we ever ran in this. Men across the country cutting it out. The more you ejaculate, the lower your risk of prostate cancer. On refrigerators across the country, nightstands, you name it. What's the truth?
The truth is that there is some truth to that based on a huge study, a lot of puns in this conversation. Let's excuse them all now. A huge study looking at over 30,000 men for about 10 years, published about a year ago, showing that men that ejaculate at least 21 times a month, 21. average, and they started studying the men. The male group were from the age of, between the ages of 29 to the ages of to their late 60s. Average 21 times a month had a lower risk of not only prostate cancer, but even the more aggressive type of prostate cancer. So 21 times a month, what do you do with that information? Well, clearly you know what to do with that information, but what if your partner is not into it? You have the type of partner that's, there's no way they're gonna,
21's a lot.
It's a lot. It's a lot. So, and they didn't differentiate with partner. Right. They didn't differentiate with partners, more than one, and they didn't differentiate with those that just took matters literally into their own hands and masturbated. Right. It was just ejaculating. It's just the use of the plumbing. Right. 21 times a month. So still a lot. Still a lot. Although some men would argue against that.
Depends on your age. Depends on your proclivities.
On a lot of things. But that's what the studies show, with no clear indication as to why that is. And some theories include that, about 70% of the semen is produced in the prostate. So if you don't let that out, it kind of clogs up the pipes, if you will. There's also antimicrobial properties in semen and sperm. So when a man ejaculate, they're literally cleaning out the pipes as they ejaculate or when they ejaculate. There's all those other factors that are probably the reason why. But I'm just the messenger.
All right. It's a good message to say. All right. Probably the best video we've ever done. Men, get on it.
Literally.
Get on it.
All right.
Thanks, Dr. Gio.
You're welcome.
If you liked what you just saw, we have a whole lot more with Dr. Gio Espinoza at our website, bottomlineinc.com. And do me a favor, share this. Tell your friends. We have so much great information. Come to bottomlineinc.com.
Men, go for it. That's what the doctor says. Go for it. More ejaculation will help you clean the pipe. Go for it, men. Go for it. Una go do am. 21 ejaculations a month go clean the pipe, because they say in the semen, the white fluid where they carry the sperm go from the parts of the mommy, where una do the mommy and daddy business. They say even that small thing where they inside the sperm, and they clean that pipe there. So do ya, my sister there? Una make let the man and not get this prostate cancer. Una give them.
And anyhow you do am.
So does active sex decrease the risk of prostate cancer or increase it? Can it be cured? How can I make use of it so that I don't lose it? That's the penis. Okay, who is this? Omar Romansare, you watch that video where we just watch? If you just join, you know watch the woman say, the doctor say, every man for ejaculate 21 times. You forget sex 21 times and sperm and come and reach that climax day 21 times in a month. If you do that, and the small microorganisms and they inside that semen, that white fluid where they come out, that one and they help for even clean that pipe there. So the prostate that side it they inside that fluid they come out, that water, that sleepy water where they come out, now they. So they say it's good for me. You get that mommy and daddy business 21 times in a month if you ejaculate. So now that day you for do for me you get that cancer day now for increase, not for decrease you sex, so increase that. Beg the Cecilia help you every net if you able. May you do them. Yeah. So being to say for add small things to that day.
Well, let the woman out there, una use una hand. Una hand self can do the work. Una jack and tell me. We go take a break now. Come back, we will continue.
Yeah, no, you said there's no truth in that. The more you ejaculate, the less risk of prostate cancer. No, to encourage no to promiscuity though. Yeah, we know the tell us say go round and the waka outside. not so that day you dey do now with your partner with the talk. Whether you married or you not married, but you get your partner where you dey, will not they say go do a almost say. But every day, not so bad thing that day. If you have it, why not? Use it. It's yours. Easy. For now, made the mandate say you go ability solve. It not go take you from where you can see there, they look you face. It take you from where you can't do the business. Now that they many man they go away there, they go fend the wealth. Now that they say. So my sister they I want for more when I help the man there. Let them do this thing. When I read the video, what they say now for do them. The more you do and the more you protect yourself from this cancer. At the early stages, many can take medicines belonging to a class called alpha blockers to manage BPH. The teaching is that these medications can also lower blood pressure. So these medications generally are taken at night to avoid hypertension, especially if taking other medications for that. Yeah, so not true. Before you take any medication, you need for ask, not just they go now. That make they say not even transfer your medication to somebody. Go take your medication when I just you. Okay. We have a caller. Caller, who said a call from a waiting at your name. Good evening. Hello.
Hi. Hello.
Hello. Hello.
Hello.
Hello. They hear you loud and clear. Yes.
Can you hear me?
Yes, we can hear you.
Okay. Good evening or good afternoon. I just get some few questions. But before I go say anything, the doctor will be there online. Really. This time we also have brothers. Really, me are so impressed about that doctor. The way we explain. I really like that doctor. Now we own brothers in this. So really we go for help. We own brothers then. We brothers then. Believe me, most of them really educated. So I get one question really about the symptoms then. I hope somebody will answer me. I've been done, me not man really, but the time I be young, I began gonorrhea. And gonorrhea and cancer, according to the symptoms the one that they say, I don't know what thing that is, how you will know, because gonorrhea, you get the same symptom, and the way I don't explain about cancer. So I don't know whether young or old, because gonorrhea, you know, they choose whether young or not. And when I talk about cleaning the pipe, that's, I don't know, really in a difficult situation, and if you didn't oversee, then you will see how difficult it is. We women are not agree even for cleaning the pipes. That is very, very difficult. Women, they do 2-3 jobs, and we ask them, they say, attire. That particular was the true being on this side of the country. And the other things I really want to talk about back now winter to the silent day, man of the peace, I don't know whether me not to woman really, but man of the peace very faster than summer. I don't know if we get any answer about that. And we all brothers and salon people, then they know they do tests until even in overseas, they don't agree for go hospital until sickness don't put them in a bed before they do. But the other thing back what they asked, we don't know about most of these tests, and it's how you do those different medical people, and I know the times they are going to use them for do this test. What's not the test then what you would do for know whether you get prostate cancer or not? So if I know I'll take time more for other callers then, but I'm more concerned in this about cleaning the pipes, about gonorrhea and cancer. How that symptom you will know for say now this I get or not. And the majority of the working as they talk about the age of the some side. And they see really the reward for use bathroom. So now we don't even get immediate side when we use bathroom issue. Well, what is gonna turn? I can see managing really almost keep themselves because of we not get that facility for say. Like the most quick somebody go open for me, or allow you the business center for go pay. Although they happen too, because I've been seeing one man that will be work almost delaying all the 60s when they happen. But however, last topic for
okay, we go answer your question. Let me just say this other call, yeah. Caller, who said they call from? What's in your name?
Okay. Good evening, viewers. This is Umaru. They call from Switzerland.
Okay. Hello, Umar.
Welcome to the program.
Okay. First of all, thank you for this program. It's very educative, you know. Though I may miss some of the part that we cannot join early, but I think I don't learn much this evening. I asked some questions where 70% of the questions that doctor just answered them for me, you know. But I got one question, but the prostate cancer.
Yes, sir.
They only get treatment for it or it get cure. That's not one. That, like if somebody don't get a cancer, if they get like a cure, like where you go take treatment, then the cancer go away like 100%. Then the other question again is that the doctor recommend the amount of sex, frequent sex if you want to remain active, and also promote decrease the level of risk to get cancer. You know, but many a time there is some of my friends around who say like if you do that part in business too much, you go nerve, you go above your nervous system, you know, it could decrease your brain level, level of thinking, and so you sense, and so then also it gets some, according to what they say, it gets some certain effect on the testosterone, and so me want to really, if like that thing that I don't mention, if frequent sex, for an example, can make somebody nerve or it decrease the testosterone level, you know. So I want to know that. Then also the cure, if you get cure, or when somebody don't get cancer now, all the treatments you get, or then go get like 100% cure for cure the cancer. So my own question, and then I'll tell you, thank you. I will gladly wait for a reply. Thank you.
Well, the first thing I go say is the testosterone. It get minimal interaction with orgasm. Because when they talk now, so where a man do, where the man do my man daddy business, where they get ejaculation, where it tend they usually they spam. They say the testosterone, it get very minimal interaction with waiting they go on. You know, so I don't think say it gets anything, because you get people that back where they masturbate so much, man, then they way, then just let her. Lots of us say they don't even get woman, they just let for ejaculate. But the hormone they talk about, in there a man hormone will always there. Like for it's a sex hormone. I don't think say the more, I think say the more, I not really get make I not lie, I not get statistics for them. But just because we can do with a man the way then they talk, if you get a lot of that, if you the woman you get lots of that day, you look like a man, not so because a man hormone sort of, and a sex hormone. We get another caller, but we go, if we not just listen, we go answer on a question and all. Yeah, caller, who said they call from a waiting at your name? Good evening.
Yes, good evening. This is George from Boston.
Okay, George. You want to answer some of the questions?
Yeah, I just want to add within that. So what do we talk about concern within is we didn't talk say if you get frequent sexual intercourse, it will reduce the risk for that prostate cancer. And so you worry about if you do want too much, you will get nerve or reduce testosterone. Actually, the reduced testosterone, they can force most of the time, because after the age of 35, you can see say possibly will not be get big belly self. You see, I say, oh, you don't begin full belly, or don't begin full belly. After 35, now the reduction of the testosterone command them, they get an increase in estrogen. Okay, so that they make that belly big, and that they interfere because without testosterone don't reduce, that they interfere. They begin. They say either man they get big belly. It interfere with it reduce the testosterone, and then that can, if you know the exercise, you eat some more, you lay down, you sleep, especially if you're doing at the West, you get 2 jobs, 3 jobs, you can eat, you lay down, you know the exercise. Then when you can now power mommy and daddy business, there are other factors too that can influence that. You make sure say you're not in a rush, you make sure say you get enough time because sometimes people just want what they call quickie for doam. Yes, if you're in your 20s, that's easier to do. In the early 30s, that's easier to do. You go do and fast, then you go walk. But when we don't get to a certain stage, it becomes mental. Especially if you don't know, so now, oh, well, I did the last time. I want to quick, I'm able to nap. So now you're in a rush. So that they affect you too because it can become psychological. So let's not worry about that most of the time. And people in a way, usually people in a way they talk say, well, you get for okay, you can do it 21 times, but sometimes like what the doctor say, your partner is not in the mood, so you don't have to force them because of your own need. That could be very selfish. So, but let people learn say masturbation is a healthy lifestyle. As long as you do you not involve anybody, you do the correct way. It's okay. I mean, because we fumble them. We talk about even man in a salon. Oh, but what do they do that? Oh, it's too shameful for even admit that they do that. They even shameful.
I'm not gonna with myself. I get with. Not a crime for let you do that day because they get that same satisfaction where they do the mommy and daddy business, but that's not a way where they train yourself for let you do something for yourself. You still get the same satisfaction. But hey, with people that are no go area, you can say masturbation and they take and say nah, oh, it's an evil thing. I don't do that. I'm too decent. When it comes to sex, there's no decent about sex.
Yeah, because there are times that your partner will travel, the partner not there, or it will get by menstrual cycle. What are you gonna do? So for let people understand, say these are healthy lifestyle as long as it's done in a confined place and not to see ways for shaper. So lastly, while I go salon, while I go salon, I get people that will get a BPH that they say, hey, some man they come to me and say, oh, I get blockage, but they even shame. They even shame for talking, and then they pull me aside, like would they go like out of earshot just for discussion because they feel say that's something way unique to them. I say no, it's not unique to them. I say even as a black man, as in terms of genetic, as black people, that we are at a higher risk for prostate cancer or benign hyperplasia. I say so. Then I say where is that? No, take on like you not begin talking. I wish they don't go with you. I get a very close family person we get them. Well, every time we talk for education, it's saying I wish they don't go with you. This and that, because it don't come to the stage now where you get a frequent urgency, incontinence, and all that stuff. It is free for drink. With the same medication for you don't want to do the surgery because some of the surgeries we involve not to the prostate in the pool, but they call on the TURP. Then they do the TURP surgery, but only when they don't do they check the blood first for see if you're not a candidate. Not to all man. They go for manager first. They watch them. Then they monitor and then the teaching. With that surgery is that you cannot have sexual intercourse for at least 1 year. Some of them, and so man, no one do even sacrifice for that. Just forget that problem, a long time problem for let them solve them because they don't want to sit down for 1 year. They go say 1 year, and me go sit down. So I get another close family relative. We don't want to do that. I say, well, listen, you get to save your life. Your life is more important. I know say it's good to have sex. I say, but you don't want to begin a year at a certain age now. I say so, but I say not so. I'm trying to say go for counseling because I think the psychosocial effect of these things they are hard to overcome because go tell somebody we don't get sexual intercourse for how many years and maybe even you get a younger wife and now you tell and say, oh no, you can't have sexual intercourse. So sometimes and then you go rather prefer then what the complications then you go rather with law forbid become metastatic, then you die, then you forget about the sex altogether. So, what I want to add in terms of that, even when people talk say sexual intercourse, people are really if you're not a man, you are very active. You exercise all the time. What's the exercise not mean? So you go for go like run 5 miles, 6 miles. If you know the Africa, you know the weather can so cold. Even if you do waka, you do work out, or we grab the money, you do sit-ups, you do push-ups when you can. Then in the long run, it help you because, as we know, erection is all about blood flow. So if you don't get enough blood flow, and before you pay for enlarge, you have to have blood flow. If the blood doesn't flow to the penis, then it will never get erected. So if you're very obese and you lack of exercise, because exercise again they improve the lung capacity, and sex again involves a lot of energy. So if you're not getting energy, if you're not getting increased lung capacity, even if you get ejaculation, erection, as you go faster, the thing don't come down. Why? Because there's not continued blood flow. And then now the psychological aspect comes in, because now if you see the woman, they will not understand. Some women understand. They go do a foreplay. They go begin to, some women they understand that. They go even talk to you before they go begin to talk to you during the day. We think if we have all those things are psychological. But some woman will say, well, let's people, you don't go on the street today. I never woman away to go sleep with them. So look now, you need able to that best success. It's don't go down. That's not the reason. That may not be the reason. It could be that you're not exercising. You know, they eat right. They eat all these fatty foods there. So then so we get high blood pressure, diabetes. All them things now they just they compound the situation. So not number one offer.
Okay, thank you very much, Judge. The person back will talk about the difference between gonorrhea and cancer, because when you get gonorrhea, you get urgency for go urinate, you they piss blood. But waiting you for know the difference is where you then mark for you antibiotics where you take, and like when you say you been get gonorrhea when you be young. If not cancer you been get at that time, like you're not going to today for ask me this question. But when you get a sexually transmitted disease or infection, where now somebody where you don't go sleep with gets that gonorrhea, where you get her, you dey piss blood, where you want for go piss back, you dey feel, and so you go dey highlight, they burn you, they mark antibiotic for you, where you take her. I think say the thing be don't clear long term. Say you don't turn big man now. But not to say go happen for the cancer. The cancer back if it benign, you prostate just big or enlarge, they be able for they treat you, like when the doctor say they go do operation for you, maybe they go remove the balls or the testes, and then they go give you one way go just feel like that, just for prolong your life. You see? So now that then they do. But the difference is with the gonorrhea, as they give antibiotics, you drink it well. But for the cancer now, if even magnetant it get for spread all side, it go kill you. But gonorrhea not go kill you, because you not go even make it taper you, because when they piss, all man go your way they holler because they burn you, especially we don't see young boys them. Then they will be at the pain and they holler. So then they go straight to hospital, they go mark that medicine for them. So when they say the medicine them they well. But not also it go quick for go if na cancer you get. So now that is the difference. So I don't know if we can listen. Okay. Caller. Oh, there's two people on waiting. Okay, let me take the first caller. Caller, who side they call from? I'm waiting on your name. Sorry for keep you in line.
Hello, Mina Bobson Kadia. I call here from London.
Okay, Bobson, welcome.
They don't almost Judge don't almost answer the question for Umaru. I will just come to this side where it talk if this thing they kill. First, I want to say thanks to my brother, Dr. Kapoa, for job well done, and Una said for the good job Una they do for sensitize people that give you the awareness of health. When it comes to prostate, if them detect them early, they kill you, and you get killed. Me, for one, I don't do a man, Dr. Kapoa. We have a patient, they even don't fly with the patient, go Ghana. Enable fix them. He come back SALONE, now hospital to Name Dr. Kapua do him. And the pa is very, very happy right now. They do very well. They don't deal with them for over 5 years. They're not able to treat them. When he come, we treat them. We do the operation. It was very successful, and they do very, very well right now. The prostate cancer, like we say, nothing really affects with the man them, especially black minority, black people, them more than other ethnic minorities, other ethnicity groups them. But one thing we get problem for inside Sierra Leone, like waiting Brother George just today say, we take it like a taboo that me I go tell somebody say this is how I feel. A big problem. The man where we treat, in fact, we in Boston am to me. When he can, he say in Boston kill him. So where I want to send me go to. We get for give him a lot of encouragement, talk to him, counsel him, till finally he accepts. We get all our people then back at the same time. We don't do countless operations, prostate and me and Dr. Kapua, so we know ourselves. We don't save a lot of lives them naturally. The problem is, just like how we ask, I'm waiting at the resources, waiting at the main on how to manage the thing. The problem where we go in a salon, like Dr. Kapua say, with people, they don't get the money, they cannot afford it.
No.
You know, this small amount of people that were able to afford them, God can help them. Those who can't, and say, that woman, I ain't do don't go back by them. You know, they peace against them, you know, they this or these other things them. Personally, I feel say, as we get awareness of prostate cancer, I think it's high time we think of a way we will support the doctors them in a salon for make them able to help. That will put people the way they in a village. Like right now, Dr. Kapua now like a charity they do not Kenya. They people and they we get prostate, but they don't have the money. So he has to help because these are our people. You can't just let them go, make them go die. So at times you get for doing young. Mm-hmm. Personally, myself, we don't do some operation where the patient will not even get the money, but life comes first. Even though it's expensive, some of them, I can come and say, doctor, where this now people them will not get away. Lord just help. He say, I say, everything for do. Now so, you know. So as they get there, we have to say it's high time we decide, form like an organization, especially from the diasporas. Now see how they help those people. As we speak, me personally, I talk to Dr. Capone, the only doctor right now, because more Dr. CD Camara, he don't old, he don't retire.
Oh,
that man retired, then get from big and come back to service. And the man get in your private hospital where they run. Right now, the partner is not even able. So when I've been there, Dr. Capone, we call ourselves medical prostitutes. So we did now and therefore for Komoyanda they come, they left Kenima. Right now they do a surgical organization where they do outreach. They go and do surgical treatment, they go do operations then. Before the corona, they put local. Yesterday when they talk as we finish back then get for put local. You know, they go around the country, young doctors then for make a difference. But then they not even get the resources. So how are they tell you Australian doctors then I admire them big time. They're doing a great job. Because
bravo to them and never continue
for some people. Yes, they don't have they don't get everything for do what they do, but then they try. The first time I go salon, I make a report in salon not get hospitals. They only get buildings with medical personnel because the doctors or the health professionals not get what it takes for make them do their job.
Yeah.
You know, then get the experience is there, then get the sabi, everything there, but for make them do their job, that's the trouble. You know, and when you be a doctor in Sierra Leone, after God, now the next one, now you get the life and death. You know, because everybody feels safe. Now, when you in a hospital, let's say when you go to a corner, you go to a theater, they make some kind of cases where the patient look at you, or when you can your own private hospital, a patient look at you, you not get no option but for help them. Because when you get the eyes the way they look, they tell you, say, after God, now you get me life.
Mm-hmm.
So when you can't identify them there, we need for do things them, for help them. then they try. Then they try, but these are the systems, you know. So I tell them that thank you for the good job and everything. I must stop here and thank you for the good job.
Okay, let's see if the other person is still there online, because there was 2 people.
These are the systems, you know. So I tell them that thank you for the good job and everything.
Yes, caller, really sorry for keep you waiting. Who side they call from and waiting on your name?
Hello, Sister Salome Fadima here.
Oh, Fadima, how are you?
Yes, I'm enjoying your show. But I just want to add, I just can't the last minute, I just hear you all at the talk on the prostate cancer. And like how I rightfully say the signs and symptoms kind of what they call, but the people have to go to the doctor. The people then get to go to the doctor. But then another thing where I've been learned long time ago where they talk of with the testosterone cancer, like the testicles, like that man the way they ejaculate when they play with themselves, you go get for know if you get cancer or whatever, because they feel the lump, they feel the bump. So just like a woman, a woman, they touch in breast for do the breast self-exam. The man themselves can play with them testicles, see if they go see bump when or they move or lump when or they move. Because the regular lump, when it's cancerous, they move around. But the cancer one, all that stuff, they can help them, for making them able for detect, especially with SALONE, when not get the kind, technology or the kind, medical facility when for able. Because here in America, they tell people at the age of 40, if you're a man, you for begin go test for, prostate cancer and all that kind of stuff. Then they kill a lot of black men then, because, these are things that they suffer from. But we people then get tested, because sometimes the symptoms might be similar to other kinds of them. But if you don't begin getting symptoms, then you get for go to a doctor, go find a doctor, because doctor and then a SALONE, like how the doctor rightfully say, the money boku no more, but doctor and then a SALONE will be able, detect it. And people can live longer with prostate cancer because it's a slow cancer, it's very slow way they waiting and call it go ambog no more you sexual organs them, but they kill you faster like the other, like, lung cancer or breast cancer or the other kind of cancer. And so now that I just want to add, but you all are doing an awesome job. Thank you very much.
Thank you, Fadima. Thank you so much. We appreciate it.
Yeah.
So, can we just watch, we sponsors them and then we can out and conclude, please? We see one for welcome everybody we don't join, and we thank all the one that we don't do contribution, from George to Dr. Kabia to Dr. Kapua to Mio sister Fadima, everybody we don't join today. Una know said and to me number 1 fan, Thomas Rogers, as usual, as always, your support is highly appreciated, all of you. And then now we just want for listening to we sponsors them and we come back and conclude. And we hope say today people that don't learn, especially man them, we not able for go hospital. We hope say with this you need for go hospital for do your checks, whether not the diaspora you there or na Africa you there, please you need for take care of yourself. Like I always say, as an adult, you're responsible for your own health and well-being. So may we listen to we sponsors them, and then we go can conclude the show now. Thank you.
Why do a website when you can create an app for your business for free? Yes, with TAV App Maker, you can make an app as easy as pie. It only takes a few minutes. Simply choose a design template you like, add the features you want, and once you are happy with the results, publish it to Google Play and Apple Store, so your clients can download your app. Go to TAVAppmaker.com and create your free app today.
This na Dr. Haisibu with the Durham, North Carolina, with another edition of True Say Talk Me. This True Say Talk Me, they can present to you a gift of good health from Cotton Tree Pharmacy to the people of Sierra Leone, and also how we with the overseas go help with people forget good medicine we go help them. Cotton Tree Pharmacy don't come for solve the problem, for help with people and with well body, and for help them with medicine way they need, we go change their life. The government self not able to do it in Cotton Tree Pharmacy they do. We were the overseas, many time them, we don't get a 4 o'clock morning call. When I call they come, they say CCC.
Okay, we want to tell you now all thank you we don't can join with today, and we know say the topic is so interesting. We can talk my and daddy business. Now that not all we as human being them. Everybody want for make sure say this in your own property so they work, because some property the way you get if you not work, you get problem. So today we don't talk about, okay, as an oncology nurse for 20 years now, early detection is the key. You don't have to die from it. It's one cancer that is curable with surgery. Thank you very much, Beatrice, AC Harris. That contribution is very much appreciated. So what it is nurse they say, it don't be nurse when they work with them kind of people who get this sick here for 20 years. It say if you know say you get them quick, when they call detection, you not go die from them. And like when the doctor say this are one of the cancer that when they go pull something commodity, we go make you live. Not so why we go call it when you get pancreatic cancer, then go tell you say you get cancer of the pancreas today, in 6 weeks time you don't die, or you get lymphoma where in 6 weeks time you don't die. They say this is a cancer when you go live with them, then go do operation for you, you go get cured. So do ya, if you didn't get any of them symptoms, that's what we don't talk about. If fine for make you go hospital, let them treat you, may you not die. Because now you don't go say I not be no, now make we can at this show, and now we don't get lots of people where they come when the doctors the way they can do their contribution. When I share the video, when I send on a salon, that we people that watch them. So on that note, we think that we get for can stop the show now. So I go left being to forgive your last word.
Okay, Una, thank you for joining me this evening. It's very interesting topic. I hope so we all don't learn a lot from this. We, the woman themselves, we don't learn a lot, and try for push, remind them, encourage them, for let themselves they go and check, because you know, say man them, they're more about ego. They know how to let them tell them anything. So they allow they encourage them, allow they push them. This cancer as is curable. The only thing, the prostate cancer, large prostate, it can become uncomfortable, and then when people then get cancer, they can become so concerned and worried, say that then they can't die and they're not going to get cured. But there is treatments out there. The earlier you say, the earlier you're able to recognize the symptoms there, that the earlier you go get treatment. If you know they get erection, medicine there for that. If you're not able to control your bladder, medicine there for that. If you get cancer back, treatment there for us. So do you una come forward, una go to una doctor, them and una get the test. If they no say they low risk, if you get medium risk, like the risk not too high, if you high risk as well, then will they monitor you every year, where they can call active surveillance or watchful waiting for just see whether the cancer they progress or not. So then go put you on that kind of monitoring program there, where then go they make sure so then they monitor you prostate level when at that PSA every year, and try for see how they were able to help you. So for now, we say goodbye, and we will see you again. Una share this program, una educate una people them about this topic today. When they were able to get access to this information, the video there, una share, una wait, una don't learn here today, una able for share that to una friends there, una family them. For now, would they say good night.
And me your last story where they talk now, the cancer where the whole man them, it get cure. Although it did in a salon, but it get cure. When I go to hospital, They go give you injections. Until you're not possible to get money, you go able for even afford. Because people in the salon, chemotherapy works, and I've seen it with many patients. The same with sister, they sit and we say chemotherapy, they work for you. These are injection where they give where you get this cancer. And at the same we say, once they detect them for you early, they're able for cure you. So me want to people then today, if they tell you say, and then the PSA and these are some exams where the doctor can say then they do on a salon. If you dey salon, you don't begin show all the signs and symptoms. So tell you dey piss blood, you dey piss fast, always you dey go toilet and say your bladder full up and enough full up. You get you don't begin for do mommy and daddy business, but the thing not they work properly. If you get all the secret they do, you are going to hospital. Just ask for Dr. Kapua in clinic. You go there, they go see you. If not, they go able for help you with. If like you not get money, just go. Because the wires and the doctors, they way they train, they don't take an oath for say that they for save lives. If you cancel the worst, you not get anything. Where they go help you. But a cancer way gets where they go mend you. So not left sit on a host because you say you the shame, the pardon that you the shame. You can still live. Because life not about just enjoyment. So think a bad thing will happen to you, but you go see able for live with and do ya with a big una. Una go na hospital, or una get the signs, una go do una test, una go and do something for make una prolong una life. This life now one grain. If you take care of her, you go enjoy her. And especially sick with their medicine. If you left it doctor, it kill you. That means say you don't kill yourself. So as for me today, my last word now I don't tell una. I dey tell una bye bye. And I want for make una share the video every week, 6 o'clock British time. We dey on with different topic them. Una join you and a medical person join you give your contribution. We not so doctors and we not nurses them. We dey raise awareness of them disease here. So for let people that know. So when they begin feel out and go say, that woman be talk say something like this, make her go check back. Now make they do this because this in lack in our country, health education all day and well body na gentry. So do ya take care of yourself and for everybody, we go see una back next week. Una bye bye from me. Good evening, ladies and gentlemen. My name is Salome Heights. I am the host for the health show on Voice of Salone Network. We are making this clip to tell all our viewers that we are healthcare professionals, nurses working for the NHS in England. We are not medical doctors. We're here to raise awareness of all non-communicable diseases. Example of them is diabetes, hypertension, the cancers, and all other health issues that we know are affecting our people. We are not here to prescribe. We are not here to diagnose. We're just here to tell people about some diseases so that when we tell them about the signs and symptoms, they'll be able to watch out for these signs and symptoms and go to their medical doctors or their healthcare providers. The videos we play are taken from YouTube where everybody goes to look for information. They are not ours. So with this, I just want people to know that all we're doing here is raising awareness of these diseases because not all of our people can go on YouTube and access the information. Thank you very much for watching us, and please continue to watch us because you will learn how to take care of yourself because health is wealth.